Well, happy, beautiful, amazing day. Dr. Bob Rakowski here, wellness transformation expert with today's Doc Walk podcast. I think this is the most successful, healthy husband-wife chiropractic, natural medicine, functional medicine team. So happy, beautiful day, Chad and Becky, doctors Chad and Becky Peckles. We're going to start with a simple question, which could be complex. What led you on this path?
Great question, and it could be complex. How much time do we have? No. Yeah. We started Boy Meets Girl in grad school, fell in love, but had kind of a same vision our whole lives, wanting to make an impact on this world and how to reach as many people as possible and support health. We believe that should be a number one priority in people's lives, because without your health, the other things, you just don't get to enjoy the other things, right? So we started a practice with another business partner over 20 years ago now, which is incredible. Yeah. And grew, and we really have a flourishing, thankfully, waiting list practice here in Minneapolis, Minnesota. And then you get to a point in your practice where you want to do more. And what does that look like? We also have two beautiful daughters, and we're at a stage where we wanted more time and flexibility, and learned there are some stiff boundaries within a literal physical office space, right? So we needed to look at, how do we still live our mission, but have more flexibility? It kind of came into, thankfully, you, Bob, as our mentor for years, in our clinical practice and life. And you shared this amazing health benefit of coffee with us. And at our other business partner at the time needed it for her health. So we thought, oh my gosh, that's amazing. And initially loved the product for the simplicity. It was such a no-brainer of, if everyone's already drinking coffee or tea, why wouldn't we just help them make a healthy upgrade to it? And, from there, we brought the product into the office, and we're blown away with what people were coming back and telling us, which was amazing. And then we kind of started to expand and take it outside of there.
Yeah, I mean, you covered a lot of years right there. You are who you surround yourself with. And, we've appreciated being mentored a bit by you, whether you knew it or not, for many, many years, probably close to 2 decades now. And sharing what we learn with everybody else. It's like we're put on the planet to be helping people. That's why we're in the profession we're in. And if we can optimize the ways and the avenues in which we are able to deliver that support and help, that was our goal.
Beautiful. One thing I do want to know about that backstory, were you always naturally minded? Was that a naturally minded family? Or, you've chosen Doctor of Chiropractic. You're both brilliant enough. You could have taken any path you wanted. You could have been a nuclear physicist, a neurosurgeon, whatever. Why chiropractic? There's a downside to it that we've lived, because there's a little stigma against natural medicine. So what led you in that direction? And do you feel that stigma, and how do you deal with that?
Growing up, I actually started out college as an art major, but grew up in a family that we had a big garden in our backyard. We really didn't eat out at all. We were very active. I would say our parents put us in positions, talking about that generational support and guidance, they put us in positions with tools and things like toys and dirt bikes and backyard things versus like a video game system and fast food out of the cupboard. We sat down for family dinners, and we just hung out as a family. We did stuff like that. Switching gears into college, my real drive to get into the chiropractic world was a personal experience. I had never been adjusted. I always felt pretty good. I was dating a gal. It wasn't you. And her father was a chiropractor. We were going down to visit in spring break, and we drove down to New Orleans, which Dr. John Salmon is his name. And we were getting closer, and was like, oh, I can't wait to get my neck adjusted. This has been a long drive from Minnesota. And so I was like, yeah, I have no idea what you're talking about, but let's do it. And so I got adjusted. And the next morning, I was like, I feel great. I asked Dr. John if I could go to work with him while I'm on spring break. So I snuck into his office with him. He introduced me as an intern. I was a fly on the wall, just kind of watching what happened. And it was pretty cool, to see these people coming in from a 7-year-old kid to a 90-year-old woman to people like Becky and I. And everybody left with a smile on their face. Everybody left happier than when they walked in the door. And I was like, no, this is pretty sweet. I feel incredible. These guys all feel just like I do because they just got treated. So I came home and switched my major. I switched from my graphic design to chiropractic.
I happen to think that's divine intervention. How could it be anything other than that? And what college age student on his spring break going down from Minnesota to New Orleans wants to spend time indoors observing a chiropractor. I mean, I thought I was dedicated. I mean, something must have pushed your button. And keep in mind, you were a healthy athlete, beautiful diet. You've always been, both of you, the picture of health. So you didn't go in with an injury or illness and chiropractic was your miracle. You just went in as an elite wanting to become more elite. And I'm pretty sure that happened, because why else would you go back and say, oh my God, I want to spend as much time with you as possible? Becky, how about you? What got you moving in that direction?
Similar. I grew up in a very health-oriented family. My parents were always about eating healthy and healthy relationships and movement and a lot of outdoor time. So I always, I think as I was finishing high school and thinking about what was next, I knew my big interests were nutrition and exercise. And then I found a major called exercise science. And as I was going through college, I thought, I know I don't want to prescribe medicine, or I don't see myself doing surgeries, but I want to be able to do what I want with people to help them change their life and bring health to their lives. And I didn't even know what chiropractic was. So right near the end of college, my sister was in a car accident and met a chiropractor. And I ended up going to work with her as an exercise therapist. And as soon as I learned what chiropractic was, I was like, oh my gosh, that is what I've been describing. I wanted to do, all of this. And here it is. It's actually a profession. I had no idea. Even though I had been adjusted as a teenager, which I completely somehow didn't make the connection because I have a significant scoliosis. And it helped me tremendously. I never needed to wear a brace or anything. And that was because of my mom's doing. Instead of bringing me down here and having me wear the brace, she took me to a chiropractor. So yeah, it was just a no-brainer for me once I learned what the field was and how it was supporting the innate healing. It was completely in alignment with my plan. So
I just then bridge to, what is your favorite demographic of patient, your favorite treatment modality, and maybe your favorite story? So that's a lot of questions all at once. I may have to remind you back to back, but I'd like to hear from both of you. Favorite demographic, favorite intervention, and then favorite overall story.
I personally like treating people that I like all ages, but my very best would be, I would say, a teenager up to probably a 60-year-old. It's a pretty wide spread. But I say that loosely because my favorite part of it for me is when they just come in and just say, tell me what I need to be doing. There's a lot of people that will come in and they always question everything. That's one thing with the teenagers you never get is, okay, I will do it. I'll take the supplement. I will follow the plan. I want to get back to my game. I want to play, I want to feel better. They just do it. And a lot of times the generations up, they might have a couple questions, but a lot of times the ones that are just willing to get on board right away, get the best results, those are the people that I like to work with, the ones that sort of just say, yes, like, let's do this. I came here for a reason. I want to get better. So tell me what your opinion is.
What about those patients? What do they have in common besides they're human and in your office?
The thing that I like about them is the teenagers like to just come in and actually just get to work and feel better. And a lot of these people are either a weekend warrior athlete or they're playing a high school level. We sponsor a few of the local teams here, which we just won first in state in hockey, by the way, again. So yeah, that's awesome. But when you get these younger guys in, or these younger people in, they just want to feel better. They don't have any questions. They trust you. They're there for a reason. Usually it's their parents bringing them in. But as we get bigger and older into that demographic, it's really fun to work with people who are a little more established because they just say, yes, let's do this. They don't have a lot of questioning around, how do you know this is going to be helpful? They just sort of get to work and they want to feel better faster. I guess that's the ultimate goal of why I like that group.
Well, it's very broad, but you know what's so fascinating is I don't know if I would answer it exactly the same, but I do like elite athletes of any age, and I treated a retired Houston Oilers. And this guy, now he could play the senior golf tour if he wants. He kept himself fit and athletic, and his body still moves well. He's got that great hand-eye coordination. But here's a guy that was an all-pro, coached college, coached NFL. It's pretty fascinating the impact that we can have. I guess the point I wanted to make is they know once they get that experience of good balance early on, they don't ever want to lose it.
Yeah.
Agree. My very favorite thing to do in the world is to treat a newborn, like freshly born. I love to be at the birth if possible, as soon as possible. And I really love treating them in utero. I love working on the mamas too. And similar to Chad, I love broad spectrum too. And generally our practice is built on people that are really conscientious making healthy choices and proactive in their health. That's what makes it fun too. But yeah, those little people are my favorite.
Yeah. Well, by the way, there are some intrauterine treatments, which are usually invasive. I'm talking about doctors going in and actually, they've even done some surgical repairs on like blood where there's twin to twin, transfers and things like that. Oddly enough, I had a patient that we resolved that with good natural medicine. And they thought they were going to lose one of the babies. And I don't know what made the surgery risky where they couldn't even do it. But now she has 2 healthy babies, and that's a great way to go. So you're not actually adjusting baby spine through uterus. So I want to make that clear through everybody's point here. Healthy moms, healthy babies. That's very, very important.
Thank you for that clarification.
Yeah. And well, you and I talking to each other, we get that. But someone might be listening. They go, okay, wait a minute. I don't get that at all. But now once they're fresh out, and by the way, our 5th granddaughter, due at the end of May, 4 beautiful granddaughters. They have never been intoxicated by anything. Some of you that are watching this will actually learn what that means, or you'll know intuitively what that means. We don't want to be censored. But, RFK is bringing some good information out that maybe parents should look into a little deeper. And even Tucker Carlson, I'm trying to think of the guy he interviewed, Steve Kirsch. He's looked at some of these medical interventions and he says, guys, we have purposely been kept in the dark. People have been censored about things that don't work. And let's face it, chiropractic, they attempted to destroy it, right? The American Medical Association was found guilty of conspiracy and antitrust violations trying to shut down this competitive profession, even though I don't think it's changed much since we won that in the 1990s. But what do you do with a brand new baby, Becky? What brand new, just fresh in the world?
I mean, it really, to me, it goes back to the root of chiropractic. It's just supporting their already perfectly naturally born ability to heal. The thing is that what can happen with in utero positioning and the birth process, sometimes they can have areas of interference, things that are tight and stuck and twisted. And we just do it's about as much pressure as you would put against your own eyeball. And I call it an unwinding, really. You just gently help them release anything interfering with that innate, and it will support them to nurse better, help their digestion. A lot of times they'll have some upset tummy issues going on just because of tightness of things, or reflux, kind of spitting up, irritability, just having trouble regulating. So it supports all those things, but it's just the most gentle experience for them. And I love when they unwind and then they just kind of melt in the mom's arms or dad, whoever brings them in. It's so beautiful. I want to piggyback on that. So there's chiropractors now that are trying to get a good Instagram following by who can make the biggest explosion of an adjustment, right? These pops that if you don't know what that's all about, that would be maybe a little bit scary. But I like what you said, eyeball pressure. That when you look at that beautiful spine, hey, the muscles are not yet developed. They can't even pick their head up. And none of us remember the trauma. But oh my gosh, if you've ever seen a live birth, hey, that baby is going through a lot that, we often call them cone heads when they come through the birth canal, and then nursing straightens that out. Do you do anything with the skull? Do you do any type of pediatric cranial manipulation? I do, yes.
Okay.
I always incorporate the craniosacral balancing.
Want everybody to know how legit, how wonderful this can be. And by the way, once parents have kids where the first one has that level of treatment, they want it the same for everyone because it is absolutely magic. Now we're going to go with your favorite modality, more or less. I mean, is it the adjustment? Is it nutrition? Is it acupuncture? Is it massage? Is it a hug? And maybe it's a different one of those things on a different day, but what's your favorite way to revitalize that health and innate intelligence, I guess, that healing ability of the body? For me, I still love hands-on. And there's just something so amazing and powerful connecting with another person like that. I love the hands-on. And an adjustment could be anywhere on that spectrum. For me, it's all different techniques, but all about that balancing and supporting their body. But also, over the 20 years, I've really learned it's so important to connect the nutritional needs and the mental emotional, or they don't hold adjustments as well, too. So I love the hands-on, but that part about helping figure out the lifestyle pieces, what people are doing when they're not on my treatment table, I just love that just as much, too. Chad, how about you?
Yeah, I would agree. The chiropractic power is so impressive. Nutrition is just as impressive. We are trained to do the chiropractic service. So I like that. That's a unique thing that only we can do as trained providers. Nutrition is a huge part of our practice. And it is, like you're saying, I mean, if people are coming in and getting adjusted and they're going out and eating McDonald's and they still have a headache, it's like, well, what's happening here? And it's a lot of times we don't even need a supplement in this case. It's like, just make some better choices at home, eat real food, feel real good.
What I like to tell people, when I give a report of findings, right? What's causing the problem? Can I help? How long does it take? How much does it cost? I tell people our goal today is to make an instant difference, and the adjustment will do that. 99.9 out of 1,000 times we make an instant difference that moves in the right direction. But the goal is to make a lasting difference. And usually we have to find that lifestyle factor that's holding them back. Are they not getting enough sleep? Are they stressing out of their minds? Are they eating junk? Are they living in a toxic environment? We're seeing way more of that. Down south here, we get a lot of mold issues. You probably get some of those up there as well. Number one rule is if you're in a toxic environment, you got to get out of it, because environment will trump everything else. If you're doing great things for your body most of the time, but you're sleeping in a toxic room, we might have to address that.
Yeah.
So how about some fun stories, some miraculous stories? They don't have to be total miracles by medical standards, but they probably are from the family that you worked with. So 2 miracles, one for each of you.
I'll do one because the gal was just in the other day. So I had seen her years ago. This was more just a straight up chiropractic story. Her main complaint for coming in was she would subluxate her patella totally off to the side, like you'd see in a soccer game. But she would do it at work. She'd do it most of the time in the airport. Excruciating pain. Briefcase would fly everywhere. Big scene would happen. And so she finally came in on a referral and did some muscle testing with her, found out a handful of things going on, balanced her out with a couple of treatments to her low back and her pelvis. And since then, she was just in and she said, I've never subluxated my kneecap ever since I've been coming in here. And she can tell now that I don't feel painful, but I can tell that my leg isn't firing real well. My glute's not doing what it's normally supposed to do. My workout was way more challenging. And I know I need to get in here and do a little follow-up with that. So it's been probably 6 to 7 years. And prior to that had been happening about once a quarter. And if anybody's ever had that happen, it's not a fun thing to do quarterly. So if we can eliminate that with some simple hands-on care, that's a pretty cool win.
Well, and for our listeners, by the way, what you did is you got after root cause, right? There was something in the spine, something in the pelvis. That was the muscle imbalance was the result of that. Hey, and if we didn't have perfect balance, our knees are miracles anyways, the most complex joint. But the forces are going to laterally track that patella if we're not balanced. If the pelvis is off and you don't address that, I don't care how much rehab you've had. I don't care how much nutrition you've had. I don't care, how much acupuncture you've had. You got to balance that pelvis. And same with lumbar spine, right? Or wherever that's coming from. So well done with that. And what a fun case. Becky, how about you?
One of my most recent fun ones was a 3-year-old little boy with chronic constipation and trying to do potty training and all those things at that age. Any of you other parents out there know that can be a tricky thing, helping with that. And this little boy was just really having struggle with bowel movements. And he had been to his regular medical doctor and they were just trying to pump him full of Miralax, and then he was having accidents because it was too much. It was a really vicious cycle, and it was also that creates a lot with the parent and the child, and issues around going to the bathroom and being able to go to preschool and all those things. So they came in, and we worked on the areas of his spine related to the colon and the digestive tract, and worked on his diaphragm and helped figure out some things with his diet and hydration, and pretty much had an accident on the way home from the office, which is one of my favorite side effects working with kids, that a lot of parents will say, blow out on the way home. Thanks a lot. But
yeah. They're actually excited about it.
Yeah, but that just, to me, that changes the trajectory for that kid for a lot of years to come. If he can, a healthy gut is linked to absolutely everything we know, gut, brain, gut, heart, gut, everything. So that's kind of one of our roots we always go to, and the younger, the better.
Yeah. There is one, I had another guy, and I'll be quick with this one. This is more just straight up nutrition or avoidance. He had come in years ago, and he would have these choking episodes where he would literally drive himself to the ER. He'd fall out of his truck at the drive up, and they would have to incubate him right in the parking lot because he wasn't able to breathe. So they were doing some testing with him and diagnosed him with eosinophilic esophagitis. So they had him on an autoimmune product. They had him on a bunch of other things. And he kept having incidences of it. So he came in to see me, and I just asked him a few questions, right? I mean, our diagnosis is mostly in the history. So I asked him, what do you do for work? And he had a portable service cleaning semi-trailers. Well, you can imagine the caustic acids in this sprayer. Well, he's not wearing any type of respiration. He's not wearing any type of protective equipment. So, he shared me a list of these acids he's using to clean these trailers, asked a few more questions, and lo and behold was like, hey, actually just get a respirator, take your job seriously, avoid this. You don't need this medication anymore. I didn't tell him that. He figured that out on his own. But he obviously never had an episode since then, just simply removing the cause.
Yeah, how wonderful that you actually took the time to figure that out.
Yeah.
I mean, too often we think there's a pill or a potion, or some people think it's a nutraceutical or an adjustment. And maybe all those are components, but the ultimate answer is what's causing the problem. Let's address that. So yeah. Well done. Now, advice. And it could be any type of advice you want to give. I'm thinking about the general listener who hasn't optimized their health just yet. You two are just in every way shining examples of that. If you could give just one tip, and it might be different for each of you, what would that tip be?
I kind of go back to fundamentals on what could you do better and choose just one thing so it sticks. And I look at the building blocks. Is it hydration? Is it sleep? Is it movement? Is it food? Mindset? What could you do better? And to just pick one thing to focus on and block it in your day. Like actually schedule that. If it's water for you, let's decide that's going to be your goal. We know hydration is important. So how are you going to get in, or whatever versions of healthy liquid you can in your body, to start with just one thing and build from there. And many times that's what happens. When you start to do one thing and feel better, then you want to make other better choices too, right?
Yeah, isn't that amazing how health is contagious, as is sickness? You get a little healthier, you want a little more. So how fun.
Yeah, I think it's always fun when people come in and say, I did the whole 30 and I felt great. It's like, oh, so you ate real food for a month. Good job. Like, you should feel good. That's what you're supposed to do. I would piggyback on that 100% and just say, meeting people where they're at, understanding how big of a bite are they willing to chew, but really having it be change one or two things. Whatever you're going to do, just make it be successful from the beginning. Because if you're looking at losing 100 pounds right out of the gates, that's intimidating for some people. Some people, that's their motivation. If somebody's really intimidated by that, then we're just going to lose 1 pound. Let's lose 1 pound. So meet them where they're at and have them set up a plan that is successful right out of the gate, so they see that consistency day after day after day.
That's certainly a tip from sages of wisdom. Little victories. I asked one of my mentors, he said, get them a fast victory. And I asked the question, can the victory be too small? And here this sage sat back and he's stroking his gray beard and he says, I don't think so. I don't care if it's a micro step. That is a step forward. People want that victory. They want that positive reinforcement. Yes, I did it. Want one bite early, or maybe I made a better choice on that food, and then just compounding it all the way through into every aspect of life. How do people get a hold of you?
Well, we have our website, lpwellness.com.
lpwellness.com, L, letter P, wellness, like it's normally spelled, .com.
Yep. And if people want to explore conversations with us, we have they can set up a complimentary consult right on our website. Back to your mold question, we do air quality testing as well. We do mold consulting, but that's the best way to get a hold of us.
Beautiful. And by the way, you also have a podcast. We can give that a plug as well for people listening.
Sure. Yeah. We got it off the ground a little bit. It's Wellness Really. It's on Spotify. We've got 18 or so episodes. I've kind of parked it for a little bit. It's a lot of effort to get them out there. I might pick it back up again. But if you like them, follow it, share it. Very good. Well, you know what? I'm going to finish with how I started. You two are one of the most beautiful, successful, heart-centered, amazing couples. You live it, you build on it, and you pay it forward. And by the way, for those that listened to the early conversation, we're in business together with reishi-infused coffee and tea. Why? Because people drink it every day. They never need to be reminded. They never plan to quit. And it gives us all global reach just like that. Thank you all for listening. We have more episodes coming. And I might even invite you back with a specialty topic, because you two are just bubbling with wisdom, and it's a joy to listen to you and to be your friends. So thank you very much.
Thank
Back
you
at
so
ya.
much for
Thank you.
inviting us, Bob. We just love and respect all that you're doing and are happy to be part of it.
The honor's mine.